Good afternoon. This is United TV. My name is Kemal Erkan. I'm the chairman of American Surgery Center. Today is March 15, 2024. One of my favorite people, Dr. Isaias Irgau, is with us. Dr. Irgau, how are you doing?
I am doing great, Kemal. We've had a fairly long, relatively speaking, break since the last live Bariatric Friday, so I am thrilled to be back.
As we try to do on a regular basis, this is our way of communicating with our patients and supporting them who are going through the process, and also for those who complete the process, did their surgery, and then see what different things that they need to do. And our format is we have different topics every week. And today we are going to discuss the support group aspect of the bariatric surgery in our Bariatric Friday session. So, Dr. Irgau, as you know, I was in our Turkey office for the last 2 weeks, and there were a couple of people that I know, they had bariatric surgery, and one of them had some complications. And then I just realized how important what we do, being here and presenting this, but also it also kind of remind me that we have to make sure that we are making this available in other places, other countries too, because not everyone knows what's available for them, what type of support available for them. And this is part of the support aspect. What we do today is, and this person, the complication, initial one was very interesting, that I couldn't believe that this person did not take any vitamins after bariatric surgery, none, zero. So then I'm like, how can you not, right? So, well, they don't have the same resources that we have. So our program has, so their program didn't have what we have. So, when we repeat these, it sometimes feels like, do we have to just repeat different topics every 3 months? Can they just watch the one that we did from 2020? That's not the case. It's a different, I believe that there's a really important benefits for the population that we serve, and I'm so glad that we are doing what we are doing.
Absolutely. So that is correct. Essentially, it is true that the themes are similar. The issues we discuss are very similar. However, we present them in ways that are not repetitive. Often they are more enriched by the more recent experience you and I have by taking care of patients, on a daily basis. And this, it's not a lecture format either. Sometimes you can go to a lecture, and no matter how important it is, the kind of didactic and pedantic presentation can really get you off focus. Whereas a conversation like you and I have, which is very often impromptu, very often inspired by real experiences that we come across, can be much more important for people in terms of really relate to what they're feeling and what they're going through themselves.
Exactly. So now we have, when we discuss the support group aspect, there's the support and there's the support group. So, and in the support group, I think many of the things we are trying to accomplish in terms of the awareness of the problems and sharing the issues, that would be helpful for those individuals. But understanding what type of support they need and why they need support also is important for us to kind of go over. So if you can kind of summarize what we are providing, and then I'll go into some other channels of how they can actually access to those tools.
Absolutely. So as the name implies, a support group really is a community of people Kamal, that comes together from time to time. In our case, it's once a month, the first Tuesday of every month. And nowadays, it's actually virtual because we have excellent platforms for really communicating in a virtual manner. And it's a community of people that comes to discuss any and all issues pertaining to the bariatric surgery journey, right? So it is clear that bariatric surgery is a transformative experience, both physically, obviously, because people change a lot as time passes after bariatric surgery, emotionally, and also in terms of challenges that they may have in their daily life, right? So coming together and being able to share all this in a safe environment is what a support group provides, right? Both physically, mentally, and also from a practical point of view. If there is a place and a time I can refer to on a monthly basis, maybe once every 2 months, and I go there and I listen to people and I share my own experience, I can only grow and become better, in that journey. Clearly, these are places which are very safe for people, right? Yes, you can have very understanding family members, you can have very understanding friends, but because they have not gone through it themselves, they cannot provide you that support that people with the same experience can, right? And that's why it is important. Very often, as you're going through these changes physically, as you're going through fluctuation of emotions, you may not get that support on your day-to-day from your loved ones. Basically, they may not be able to understand you fully, right? So you need a space where the struggle doesn't have to be lonely. You shouldn't be going through this just by yourself. You can go to a place where other people with similar experiences will be sharing their own with you. And that is basically what a support group is. And it's a very important component of any good bariatric program. And I'm very proud to say that we've had a support group really meeting now for years and years. And we've accumulated a great deal of experience on how to run them, what are the best practices, and how people benefit from them.
Sure. So in our domain, there are a couple ways of reaching out to the support groups. So we have one on our Facebook page.
Yep.
These are private, it's a private page. We have to verify whether or not you are a patient of CHRIAS. And I mean, someone has to verify, so we don't let anyone in. So it's a private place. So we see a lot of people sharing their progress. And it's very motivating, actually, when I see them. And they also ask questions. And sometimes when we see some of the questions, maybe, or some of the answers rather, is not in the right direction, sometimes we do actually reach out to those individuals and then try to make it safer from that point. But anyone can easily sign up on Facebook page, and then I'll share the screen in the next maybe 10 minutes or so. But before we do that, there is also, when you go to our CHRIAS website, you can, on the top right, there's a part where you can go to sign up for our Zoom events that happens first Tuesday of every month, and run by Dr. Gail Wynn. Usually she's the one who's leading that. And again, in that one, there's more interaction and there's surgeons available. This coming month, in April, there will be someone with her, if I'm not mistaken, right, Dr. Erkan?
Yes. Actually, the topic will be plastic surgery after weight loss surgery. So she will have a guest, Dr. Gillespie, who is a plastic surgeon in town, who will be with her to answer questions about this extremely important topic, which comes up time and time again, of course, as many people will understand. Whenever there is massive weight loss, there may be excess skin in the different parts of the body that sometimes people will find very difficult to deal with. And one of the solutions, not necessarily the only solution, is excess skin removal surgery, which by definition really is a body remodeling surgery. And plastic surgeons are the ones that we refer people to for this. And so Dr. Gillespie will be with her. And the topic of this particular support group meeting will be how to deal with excess skin after massive weight loss surgery.
So that would be for those especially who are able to lose a lot of weight. One of the side effects of losing a lot of weight is the excess skin. And then I think the plastic surgeon being available in that setting is great because these are free events. These are for our patients.
Yeah.
They can sign up. Actually, before we maybe move on, Dr. So what I'll do is let me just share my screen so then
Great.
I can demonstrate how they can actually do that.
Yep.
So if you can confirm you're able to see what I'm sharing.
Yeah, I see the CHRIAS website. Yeah.
It's a great website, right?
Yes, fantastic.
So now, as soon as you go to our website, there is there you can sign up for weight loss seminars.
Yeah.
You can put orders through the e-store,
Yep.
and this is the support group meeting registration.
Absolutely.
That's the Zoom link, and this one is the Facebook support group. So if you click on this, it will take you to this guy here, and you just need to register.
Absolutely.
Now, if you want to go to the Facebook support group, then you need to, again, it's a private group, so you need to be signed in and then you need to be let in. So you can request the access to become a member.
Yes.
Now, of course, while you are on the page, this section here, you can also, if you haven't scheduled your consultation, you can do that here. And then we answer those 97% of the time, same day. So that is how you can reach out to the support groups. But another maybe support group is, again, this event, right, Dr. Gasso, because we are able to kind of see issues, questions coming directly from the support groups like the Facebook and others. But also we communicate with our patients, we communicate with our surgeons and care coordinators, so that actually allows us to kind of address certain things. But I think for most people, they kind of like sharing how they actually stay alive, I guess. I'm not talking about alive and just like maybe there's a better term for that, but just stay motivated, stay focused. Some people, they need to share. You may be a private person, then you can watch our events in private, so then you don't have to be a member anywhere. But I think 80% of the population, they do want to share their success stories. They do want to share their struggles. So I pick and choose what I want to share. I'm going to give you, Dr. Gao, a different example. I have a problem on the ribs, tendonitis for almost 3 months. And, having one of the most clinically integrated network owners, I choose not to get treatment and wait to a point where it was so bad, I was going to travel and I didn't want to have this issue while I was out of country. Then I'm like, okay, so I'm going to get the injection, cortisone injection. And it was day and night. So the problem may be not resolved, but the pain is gone.
Yes.
Because that pain was consuming my energy, and I was able to do certain things. I still do preventions and other things, but it was hell. I'm like, why did I wait that long? So of course, event like this, I don't mind sharing this as an example, but I probably don't put this on my social media page. But every time I talk to people, I'm like, look, you can't, you have to, if you are having these types of issues, you have to do this. So, because it's not worth waiting. So I guess hearing this from others, it helps, right?
Definitely, definitely. But the other point I want to pick on, about, for instance, you mentioned how a person might be a private person, right? And that could be maybe a challenge for them to have to go to a place where they may have to open up, right? Well, the key about a support group, Kamal, is that it's a safe place, right? It's a judgment-free place where people know that they are coming specifically to seek support, right? It's not somebody who has achieved everything, who knows everything, and things like that. No, we're coming for support. Everyone is joining in to get support. So that by itself provides that safe environment where people feel they're not going to be judged, right? And it is critically important because you have to be in an environment like that to be able to open up, right? And if everybody will open up, then you will be able to pierce through and see that you are not the only one with a particular problem. And but maybe there will be somebody who has walked that road before and they have found a solution that works. So you will be able to learn, among the challenges that you have as you are progressing through your bariatric journey, even practical tips, what works, what doesn't work, where to spend your energy, where to spend your focus, where to spend your time, right? All these things that you don't have to discover by yourself through months of struggling, but you can go to support groups and understand what others have gone through, right? And also knowing that others are going through the same challenges could be a skill, may give you a sense of comfort, essentially, knowing that there is a way out, that it's not just you. It's not something that is because you have a particular issue or problem. It is something that others may have encountered. And this sense of common identification with these issues can be really provide a lot of strength to people, right? And then the other aspect, which is very important, is accountability, Kamal. Sometimes if we decide to go alone and then we make plans, we make projects, and we see ahead of things we want to accomplish and do, well, sometimes we may just go and decide not to do it, or we forget it, or we become less engaged in it. When we decide to have a plan and we decide to put a project in practice in a group setting, and then we have to go back to that group, that sense of accountability is very powerful in motivating us in achieving what we do, right? And it's no surprise, Kamal, that bariatric programs that have support groups actually have better success numbers than programs that don't, precisely because these added values that the support group provides are real in their results. So there are various aspects of a support group that are really critically important. That's why we encourage our patients to really, they may not be able to make it on every month, Kamal, but if they can make it, for instance, 6 times a year, that's once every 2 months, that by itself is very, very important.
So when we say accountability, I was kind of thinking if there's a better term. It's almost like knowing that you are going to checking in with a group of people or another person versus if you are by yourself. So that brings the accountability. Right? Like I'm going to check in with other groups, so then we are going to compare how we are doing. So I think when I know I have certain deadlines, let's say, I do take care of certain things in a better way. So if my deadline is a project that's going to involve others, then I have more, maybe in a way, in a good way, some pressure to do better. So then in this case, this accountability is the feeling of it, which brings a better result, because there's so many things to share between people. And from the clinical side, it doesn't matter how much we provide these resources, it's still a lot of day-to-day things are being missed. Like I was just checking our Facebook page, and one person is saying that wanted to share, found this water at one of the places, and it has several different flavors, and it has 5 calories, blah, blah. There's a picture. Well, you may not be able to say the same thing in your office visit follow-ups. This is a good, good follow-up. So then, I mean, good share. And then one person says, look, I lost this much before and after pictures they posted. and it's hard to say that it's the same person, but they want this as well. So I think overall, how this is gonna help not just where we are gonna get to the when and how we are gonna get to the surgery. It's not that part. Mainly, it's like post-surgery that is even more crucial. Where yes, it's gonna help you preparing for the surgery. That's definitely a big benefit, but there is a short amount of time for that. We'll get you ready in 2 months anyway, so you may not have much interaction. But then after that, this whole lifestyle changes are going to be it's going to be something for people to be able to just make those adjustments. So then when you are in this kind of like control group settings, that definitely helps. But I think one other thing that I want to point out, we have a surgeon available for this every month.
Yeah.
These are free events. A surgeon who could be with her family, her kids, and do other things. She's available after hours and answer questions and brings plastic surgeon. So, it's a great way to connect and get more information for the pre and post surgery. So what other things that we have?
So the other issue that is also important, Kamal, and this may be difficult to evaluate in its importance, but equally important, I think, is to go to a place where there is a sense of camaraderie, a sense of community, right? Where you're fostering that a sense of acceptance. We're all in the same journey here, right? We've struggled with weight. We've decided to go with weight loss surgery. We've succeeded. It's transformative, but there are challenges physically, challenges in our daily life, what to eat, how to eat, what are the best foods, right? No matter how much you've learned during your nutrition classes or with your surgeon, answering specific questions pertinent to your own life may be better answered by somebody who may have walked that road and who may be at that support group.
So can I just give you an example to that? Just because I'm actually looking at the live feeds. Patient says very disappointed with the journey so far because they lost only limited amount of weight and blah. So then, because I've been watching this from the beginning, so another patient of ours answered, "Well, you are still healing. I lost 25 pounds in my first month. Give time and keep your proteins and waters. It's going to happen." And another person comes in, and then we can say these things in the doctor's visit. But when the person who went through the same thing telling you that this is normal, that's a huge support. Just like with the cortisone shot, I got this and I know how it impacted me, right? So that means this is this has to come from someone. Like you and I, we didn't have bariatric surgery. We may not. I mean, you are a clinician. You, of course, you have much better understanding than I, but I can relate to it so much, but not. I didn't go through the same process. I just saw a lot of people went through the same process, but it's not the same as if I did it. So, but when I see these answers, it's so kind of refreshing that I'm like, okay, so we are in the right direction. So this is a really good source of support for these people.
Yes. Like in many things, Kamal, what guides us very often are our own perspectives. We have our own perspective. We have our own expectation of what something is going to be like. And if those perspectives and those expectations are not met, we feel disappointed, right? The journey might be still successful, and yet because our initial expectation was different, then we feel disappointed, right? Instead of celebrating success, that you have lost 30 pounds, you're commiserating because you didn't lose 50 pounds, right? Well, if the expectation was to lose it at a certain time, right, then of course you're going to be disappointed because nobody can predict exactly the amount of pounds any particular individual will lose, right? The pace is going to be different. What we can tell people for certain is that they will lose enough amount of weight for them to become healthy. That is the critical, right? We cannot predict exactly how much they may lose, right? So this kind of expectation, right, Kemal, can be adjusted when somebody who has had the same experience and journey, share their experiences, right? Yes, in my first months, I thought I was going to lose X, and I felt bad about it. But then as I finished the journey, 6 months later, a year later, I find myself having lost more than I thought I was going to lose, right? So that, they're telling them, I am 6 months or 1 year ahead of you, and this is what the road looks like ahead. I want you to look ahead that way. That kind of guidance in this community where people know they're sharing the same kind of journey, it's very powerful in readjusting things. And why is this important, Kamal? Because once we feel disappointed because our expectations have not been met, we can lose motivation. And there is nothing worse than losing motivation in this journey, right? If you lose motivation as you're trying to lose weight, you've lost the battle completely, right? So one of the reasons we want to keep these support groups going is because we want to keep that motivation going through the various challenges that people may expect. The challenge may be my expectation were not met. The challenge may be my partner is not supporting me. The challenge may be I'm not finding the right protein that agrees with me. The challenge may be excess skin. What will I do about it? The challenge may be I don't know what I'm looking at the mirror now, when I'm looking at myself. All these are challenges that are by definition going to be new to the person experiencing them for the first time, but they're not new for the other person who's been through that same road. That's why participating in this community setting in a judgment-free atmosphere is extremely important for the success of our patients and our program. And that's why we really invest in support groups so much, because we know how important it is as a component of our program.
And also, in many cases, these supports are kind of like tangible, more specific. But I see another person saying that I'm starting my robot tomorrow, preparing for surgery, pray for me. So putting this out there for that person is important. So, and I see a lot of people who are doing the same type of stuff. A lot of people who are sharing their own photos. That's amazing that they're willing to do that. And I think this is one that everyone should be able to participate in. So, as you said, it doesn't have to be for the monthly event. It doesn't have to be every month, but if they can make it half of those would be. But I mean, I'm not a big fan of Facebook, but it's a great place for these types of things.
Absolutely.
So one of the another person says, "Good morning, family." So they call the support group family. So that means this is important for their.
Absolutely.
So, and it's so easy to sign up, so there's no reason for people not to take advantage of this. Dr. Irgau, thank you. This is after we had a couple of weeks. These breaks are in some cases necessary because we have specific topics, and we cover them 3 times a year probably, but also between our different travel schedule. But now what we are doing is we post certain events, mixing them for maybe just some of us watch 3 events together, and then we trim them in a way that it's just covering the topics. So then you can save some time. But we'll be here next week. So until then, have a great weekend, and we'll see you guys soon.
Thank you very much. Have a great weekend.